All right, welcome back, everybody. Now, as part of the Gauteng Provincial Cabinet's program to address social challenges affecting residents in Gauteng, MEC of Finance, Creecy, has for the past few days been visiting the township of Soweto in Johannesburg. Health, lack of housing and illegal electricity connections were some of the issues she was faced with during her visit. To give us feedback on the visit, or the Soweto Indaba, the MEC of Gauteng Finance, Creecy, joins us in studio. MEC, it's lovely to have you. Thank you very much for being our guest.
Morning, Leanne.
Now, your visit to Soweto is part of addressing challenges that affect the residents. During your tour, is the situation worrying? How would you summarize it?
Well, I think that this is part of a program that the Gauteng Cabinet is currently engaged in, looking at frontline service delivery institutions, making sure that the things that we are promising as executive heads are in fact being delivered on the ground. I think we saw a mixed picture in Soweto on Tuesday. Very exciting, innovative work in terms of primary health care being done at Chiwelo Clinic. You know, for a long time we've had our community health workers doing their outreach programs. This has now been augmented with a doctor service. But I think what was really interesting, because we visited two different clinics, one in Protea and the Chiwelo Community Health Centre, is that in Chiwelo they've turned the situation around. They don't wait for patients to come to them. They go out to communities, they identify health problems, they make appointments for patients. Yeah. In Protea, it's the old-fashioned way. People just come in and queue. And I think in those two primary healthcare centres, you saw a very, very different situation. The one had long queues, frustration from residents. In this innovative situation, one saw a situation where people were there with an appointment and a much higher level of satisfaction with the service that they were receiving.
Yeah, so it's a good example of what to follow that's happening in the other healthcare. But when you had a meeting with the residents, obviously healthcare coming up, what were some of the other issues that they raised were big concerns?
Look, I think there is concern. There's a large informal settlement in that area, almost 4,000 residents living there. It is a temporary area. Ultimately, those residents will be given houses at Lufereng. But at the moment, residents are very keen that the electrification project that Eskom has been rolling out in the area should continue. So far, 1,000 houses have been electrified. There's 800 that are due for electrification starting in August. But I was very disturbed by the level of illegal connections in that area, both because of the hazard that it poses to residents and the fact, of course, that services are being consumed that are not being paid for.
Yeah, and that's a very big issue, and an issue that's not going to go away. Where to from here? Because I mean, there's so much money that's being owed from Soweto residents to Eskom for outstanding bills, illegal connections. Eskom is under pressure, as we all know, and the country's suffering there because of this. So, what is going to happen? I mean, where is their intervention?
Well, I think that Eskom's approach, which is that it's better to electrify these homes and get residents to pay for the electricity that they're consuming, that's obviously the logical solution to the problem. But I think that we do want to, we have at provincial level, we have a forum where we meet with the state-owned enterprises. I think we want to raise this issue there because, as you say, we are concerned about the liquidity of local government and we're very concerned to protect their revenue generation ability.
Yeah. So let's talk about the province also creating an initiative to increase transparency in tender processes, because this is an issue I think that's a good issue. It's by opening the bid adjudication for tenders to the public will also be a way to improve payments to service providers. Is that what you're hoping to achieve?
Well, I think the first thing that we are hoping to achieve by over the course of the next 18 months, opening all tenders over 50 million rand for public adjudication, is that we want to restore public confidence in the tender process. We want the public to feel that they can see what's going on, they can understand the reasons that particular service providers are being awarded contracts, and obviously have confidence that this is going to the best service provider at the right price.
And also, I know that just on a final closing note, is the Bid Adjudication Committee met to recommend the preferred bank to manage the province's 90 billion rand central banking services or tender services. What are you looking for in the bank? What is it that you want?
Well, it's a very challenging job because we are paying salaries for over 200,000 officials every month. We're paying 3 billion rand in goods and services. We've got over 200 bank accounts, 151 petty cash books. So this is not a small task. And obviously we expect our banking partner to help us to prevent fraud. We expect them to be working with our officials on improving electronic services in the payments area. And of course, at the end of the day, we would also want to see them having a social responsibility component that supports both financially and non-financially the township economy.
Indeed. And this decision will be made?
Before the end of the month, we will announce our banking partner.
Lovely. Thank you very much for joining us here in studio. MEC of Finance in Gauteng, Creecy. Thanks again for being our guest. All right, we're going to try again. We're trying to get